Welcome to Goodfellow Podcasts. This episode is kindly supported by the Royal New Zealand College of General Practitioners, the Auckland faculty. I'm Dr. Louise Kugler, and today I welcome to the podcast Dr. Jude Ball. Today we are discussing alcohol use in New Zealand's adolescent population, what we need to know. Jude is a Senior Research Fellow in the Department of Public Health at the University of Otago and a member of the Adolescent Health Research Group. These were the researchers behind the Youth 2000 survey series, which is a nationally representative survey of adolescent health and well-being. Her research focuses on the impact of the changing social and policy context on youth trends, with a particular focus on alcohol, tobacco, and e-cigarette use. With colleagues, Jude has recently published a series of fact sheets on adolescent alcohol use and related harm based on the Youth 2000 survey data. Kia ora, Jude, and welcome to the podcast.
Kia ora, Louise. Thanks for having me.
It's great to have you here. So today we're talking about adolescent population within New Zealand and alcohol use. So what is the current recommendation for alcohol consumption in adolescents?
The Ministry of Health recommends that young people under 18 years of age don't drink alcohol at all. And in fact, the risk of harm from alcohol is greatest in young people aged under 15 years. So it's particularly important for young people to be alcohol-free, aged under 15. And the ministry recommends that if young people aged 15 to 17 do drink at all, that it should be in very small amounts, so no more than 3 drinks for young men, and 2 for young women. And they should be supervised and certainly not be drinking frequently.
So, Jude, what do we know about our young people in New Zealand, the age of onset, the amount that they're drinking, and the frequency that they're drinking?
Well, the good news is that adolescents, so we're talking 12 to 17 years, adolescents these days, the prevalence of drinking is much lower than it was 20 years ago. So young people in that age group are less likely to drink, and they seem to be starting drinking slightly later than in the past. So 20 years ago, by fourth form it was then, year 10, a high proportion of young people were drinking and partying as part of their social life, whereas that's really quite uncommon for year 10 students these days. So that's the good news. The bad news is that when people in this age group do drink, the typical style of drinking tends to be binge drinking. So rather than just having 1 or 2 drinks, it's often drinking quite heavily when with friends. And obviously there are risks associated with that. But young people tend not to drink frequently. So compared to adult patterns of drinking, which is more common, among middle-aged people to drink a little but often, young people drink infrequently but in large amounts when they do drink.
And where do young people get their alcohol from?
Well, the survey that we undertook in 2019 showed that the most common source of alcohol for high school students was their parents. So close to 60% said that their parents gave them alcohol. Being given alcohol by friends, it was the second most common source. In this age group, young people occasionally buy for themselves. So it was about just over 1 in 10 young people said that they had purchased alcohol themselves, but more often they will ask someone else to buy it for them. So young people can source alcohol from a range of sources, but parents are the most common suppliers.
Okay, and does where the supply come from, does this matter?
Well, I would say that it's the quantity that matters more than the source. If a young person is going to drink a whole box of RTDs or, a whole bottle of spirits, it doesn't really matter whether they got that from their parents or from a friend or whether they bought it themselves. But having said that, when parents supply alcohol, it is more often in limited quantities. And, from a health perspective, we're much less concerned about young people who are given a glass of wine with dinner by their parents or have a drink at a special occasion or at a barbecue where they're supervised and in an adult environment. That's much less risky than young people drinking unsupervised with friends where the quantities do tend to be higher.
And what do we know about alcohol-related harm in our youth?
I'm a public health researcher, and the reason from a public health perspective that we are concerned about adolescent drinking It's not that adolescents are more likely to drink than older age groups. That's not true. But we are concerned that young people who start drinking at a young age are setting habits for life that could set them up for chronic health problems, including cancers and other long-term impacts of alcohol use. We're also concerned that there's clear evidence that when people start drinking from a young age, the risk of dependence on alcohol or other drugs in adulthood is increased. So for that reason, we want to delay young people taking up drinking. But probably the harms that are most kind of front of mind for parents and for society and for young people themselves are the acute harms that can come with alcohol use. So accidents, including traffic accidents, other injuries, violence, including sexual violence, doing things that could get you in serious trouble, unwanted sex, unprotected sex. I mean, any of these could potentially have long-term, even lifelong consequences when things go wrong. So avoiding those kinds of harms is really important.
And thinking about frequency and the correlation with harm, obviously on first principles, it makes sense that these would increase. Is this the case?
It's probably more quantity than frequency. So someone that drinks really hard out twice a year is probably at greater risk of alcohol harm than someone who has one drink each week. The pattern of drinking with young people is that it's infrequent, but often very heavy.
So moving on to discussing those drinking patterns, you've mentioned binge drinking. So tell us the definition of binge drinking.
There are various definitions, but the one that's often used in New Zealand is 5 or more drinks on an occasion.
And how many of our young people are drinking in this drinking pattern?
It increases with age. So this is based again on those 2019 data that showed that 8% of 14-year-olds reported binge drinking in the past month. But by the time we get to the 17 plus age group, and this is among secondary school students, 42% reported binge drinking in the past month. So yeah, in that older adolescent age group, it's really quite prevalent.
Thank you. So thinking now, Jude, about alcohol addiction, if a young person drinks early, are they more likely to develop an addiction to alcohol?
Yeah, so there's very clear evidence that starting young, and that we're generally talking before 15 years of age, and drinking to drunkenness is associated with both alcohol dependency and dependency on other drugs in adulthood. And that's partly because people who start drinking young often have challenges in their lives. They may not have a supportive home life, for example, which could put them at risk of long-term drug and alcohol dependency. But there does seem to be evidence of a causal association as well because of the adolescent brain development. Introducing drugs at that crucial time does seem to make people more vulnerable to dependence.
Jude, are there particular populations within New Zealand that are more at risk from alcohol consumption and associated harm? You've mentioned socioeconomic deprivation, but are there other groups that are more at risk?
So our research shows that girls and young women are at greater risk. So girls are less likely to drink at the very extreme 10 plus drinks at a session level, and yet they're more likely to report injuries, unwanted sex, unprotected sex, and other impacts of drinking. So girls are definitely at higher risk. Our findings also show that Māori and Pacific young people have high prevalence of alcohol harm, and that's partly due to higher consumption levels, but there also is an independent effect of socioeconomic status. And the other group I'd mention is rainbow young people, so gender non-conforming and sexuality diverse young people. Interestingly, our research suggests that higher levels of harm reported in the rainbow group isn't explained by higher levels of alcohol use. So it does seem to be more about the context for use and perhaps experience of discrimination in the environment.
So we've already touched on this a little bit, but just discussing now the factors which have been shown to be protective as far as alcohol consumption and harm goes.
Yeah, so there are some really clear protective factors. I think the most important being having a loving and supportive home environment where young people have got plenty of quality time with their family. That's the number one factor. And I guess the flip side of that is that young people are free from abuse or family violence. Secondly, feeling safe at school, feeling a sense of belonging at school, and reporting that teachers care about them is also strongly protective. And for Māori and Pacifica, cultural connectedness, and for Pacifica, spiritual connectedness are also protective factors.
So, Jude, just wondering, please, if a young person is drinking frequently and heavily and perhaps binge drinking, are they predisposed to more harm? Thinking perhaps mental health troubles or other comorbidities. What can you tell us about this?
Yes, so mental health problems can be both a cause and a consequence of heavy drinking. And we know that young people who start very young and drink heavily at an early age, it is often a response to trauma or other challenges. So drinking can be a way of trying to cope with those challenges. But unfortunately, it can have the effect of compounding problems rather than solving them and make them more vulnerable to depression and other health problems.
If we're supplying alcohol to somebody under the age of 18, what are your responsibilities both as a parent and then if you are also supplying alcohol to young people who are not your own?
So if we go back to the Ministry of Health advice, it suggests that if parents are supplying alcohol to their children, that the situation should be supervised and that only small amounts should be supplied. So no more than 2 drinks per person for girls and 3 for boys on an occasion. When supplying to children who aren't your own, the responsibilities are higher. So you need to have explicit permission from the parents of that young person that they are allowed to drink alcohol. So for example, if you're hosting a party, if your 16-year-old is having friends over and you want to supply alcohol at that party, you need to make sure that all of the young people who are invited, that their parents have signed off on that and that they know that there will be alcohol there and that they approve of their young person drinking.
So you said sign off, and I'm curious about that. So that's giving a form of consent. Does that consent need to be written or is verbal consent okay?
I think verbal consent's okay, yeah.
So thinking now as health professionals, how do we screen our young people and from what age should we start screening for alcohol and drug use?
Well, health professionals who are working with this age group, a really important principle is getting to know the young person and developing a relationship with them. And so asking about alcohol, even from as young as 12 or 13, can be quite a natural part of that. For example, as part of asking about friends or about asking about interests, what do you like doing on the weekend, and so on. So screening doesn't necessarily have to be formal with a tool or a checkbox, but simply checking in with young people, understanding how they're spending their leisure time, who they're spending it with, and what they're doing should give it a good indication if alcohol is part of the picture.
And if we're wanting to use a screening tool, is there a specific tool that's relevant for youth?
Yeah, so there is actually a tool that's been developed in New Zealand called SACS, the Substance Use and Choice Scale, and that is designed for use with people aged under 19. And it's a simple tool. I think there are 10 items that can easily be used in primary care.
Perhaps we've chatted to our young person, we've done a screening tool, and we have concerns about a young person's drinking. How do you suggest we address this?
Creating that kind of trusting environment where young people feel safe to talk about what's going on with them is absolutely crucial. I think young people will quite quickly pick up if they feel like they're going to be judged, then they won't open up. That's the first thing, of course. Brief interventions in terms of alcohol use, it could be as simple as just asking in an open way how someone's alcohol use is affecting them. You know, how's sport on a Saturday morning after you've had a big night? And also checking in around any of the harms that they might be experiencing. An important principle is to start with the harms that are of concern to the young person. They may have no interest in cutting down on their drinking, but they may be willing to engage in a conversation about avoiding harm.
Yeah, that's a really good point. Thank you, Jude. And if we do have concerns, what are the community agencies we should be referring on to?
There are adolescent-specific alcohol and drug services, both Te Whatu Ora services and NGO services, but of course they differ according to what region you're in. You could use the Health Navigator or the local health pathways websites to find out what's available in your particular area.
Wonderful, thank you. Jude, to conclude our podcast, your top take-home messages, please.
The top messages I'd like people to take away are first, that adolescents are more vulnerable to alcohol-related harm than adults on a drink-for-drink basis. Although adolescent binge drinking is less prevalent than it was 20 years ago, it does remain the dominant style of drinking for this age group, putting many young people at risk of acute alcohol harms like injuries or unwanted or unprotected sex. Primary care clinicians should inquire about alcohol use as part of getting to know a young person and doing a comprehensive assessment. When talking about alcohol or other drug use, it's important to assure young people about confidentiality and take a non-judgmental tone. Alcohol and other drug services for adolescents differ by region. The Health Navigator website or Community Health Pathways website can provide information about local services.
Wonderful. Thank you, Jude. It's been a pleasure talking to you. If you're a New Zealand GP and would like to claim CPD points, our podcasts are eligible. You'll also find a list of resources used in making this podcast on our website, goodfellowunit.org. Thank you for listening.